And we'll start off this live broadcast with tonight's top story, where at least 75% of Nairobians test positive for the over 10 samples presented to a clinic in Nairobi every day. Now, our reporter Elizabeth Atieno visited the clinic, which has since launched a Rapid Kit PCR Test machine that has the capacity to concurrently conduct 12 tests within an hour, thereby enhancing prompt screening and diagnosis of STIs. Take a look.
This is the AIDS Healthcare Foundation Clinic in Mathare, Nairobi County. Every time when this facility tests approximately 20 samples for sexually transmitted infections, 15 samples turn out positive. This paints a grim picture of the spread of syphilis, gonorrhea and chlamydia in Nairobi.
The positivity rate forms around 75% of the cases we see in a day. Actually, a bigger number of patients we see is adolescents and young people, forms the majority of the patients we see, but we still see adults also come in and treated for STI.
Some of the common symptoms of STIs include sores in the genital area, pain during urination or sex, and genital discharge. However, health experts have raised an alarm over the high number of STI patients in Nairobi who do not present any symptoms, thereby posing a serious health risk and a possible surge in transmissions.
At least 50% of the clients we see in the wellness clinic don't have symptoms.
It's not a must that you have any symptoms that's suggestive of an STI, but you can also just come here to be screened for that and get to be diagnosed and also offer treatment.
Some of those STIs, they break the skin around the private parts, and therefore making it easy for the virus to enter the body.
In order to prevent the spread of STIs, Kenyans have been urged to avoid multiple sexual partners. Those found with the infections are advised to present their sexual contacts for testing.
Counseling education of these clients we offer is to break the chain of transmission, because if you don't also treat the partners, the infections will never clear.
According to the World Health Organization, 1 million people in the world are infected with at least one type of STIs every day. In 2022, 8 million adults aged between 15 to 49 were reported to have contracted syphilis, with 230,000 syphilis-related deaths reported in the same year.
Remember about COVID, people are talking about the big G. We remember the big G, big gonorrhea. When the lab people worked on it, they discovered it wasn't gonorrhea. It was actually syphilis. The problem with that syphilis was resistant to some of the commonest treatments.
In a bid to enhance screening, diagnosis and treatment for STIs, this PCR testing machine is said to be a silver bullet, as it can perform 12 STI tests at a go within 1 hour, thereby making it easier to identify drug-resistant STIs and administer the right medication in a prompt manner.
There are 12 tests in a panel. So we do not just the top 3, they were giving you the top 3, but they do a lot of other background, other tests that are usually, some of them are uncommon.
During testing for STIs using this machine, a urine, blood and vaginal sample are presented to the lab. Then the rapid kit for PCR test, which is more specific and efficient, is conducted. Thereafter, if positive, the client is referred back to the clinician, where the management is given as per the World Health Organization and Ministry of Health guidelines.
That test costs us about 4,800 to 5,500 per test, per patient. So it's not something that you can scale up that quickly.
Health stakeholders have raised concerns over limited data on STIs in Kenya. This despite STIs posing a serious risk for HIV transmission as well as infertility. Elizabeth Atieno, TV47.